So today we're moving to a new part, infection kind of illness. Infection kind of illness, we pick up two illnesses in these chapters. Certainly we don't have enough time to go over all the illness. We just pick up some common illness and we discuss. When we're talking about infection kind of illness, we're talking about the passenger infections. The mainly passenger cause the illness. One is the bacterial. It's a big category, bacterial. Another one is the virus. So still, we have lot of different viruses. So we pick up one illness belong to virus infection and another illness belong to bacterial infection in these sections. The first illness we're talking about herpes. This illness is caused by virus infection. It's a special kind of virus. They cause the infection. I believe a lot of people heard about this virus infection. The first infection is chickenpox. Like children, pretty easily got chickenpox infection. Chickenpox cured, but the virus will be hiding like on the root part of nerve branch there. So when any time patient's immunity decrease, or in Chinese we talking about body 正气 deficiency, then they will get the second infection. So from the root of the nerve branch, they will go to follow the nerve branch, passing through air, go to the body, and cause the local problems. So like this picture here, you can see some red skin rash follow the rib, cause the runny skin rashing blister there. So that's by the second infection we call herpes. So now we are not talking about the first infection. We are not talking about the chickenpox. So that part you may learn in your pediatric class or children's class. So now we're talking about the second infection here, herpes. So that's we say that's generally say is virus infections. And these viruses cause the two illnesses. One is chickenpox. The first infection is chickenpox. The second infection then cause herpes or shingles. So what's the shingles or herpes clinical symptoms? So basically, along the nerve branch passing air, they cause the skin rashes, blisters, and also cause the very painful situation. So that's basically clinical symptoms. So we say symptoms and signs mainly is painful. Painful along the nerve branch passing the air. They can go to any part of the body. like we talking about nerve bunch everywhere. Yeah, everywhere. So some people got on the face, around the eyes, or maybe around the nose, or around the mouth, or go to outer ear, or maybe middle ear, or inner ear. But we know nerve bunch. Whatever cranial nerve bunch or spinal nerves, they will pair each other. So that means they will control only half part of the body. So these illnesses generally say, they only happens in one part of the body, maybe left side, maybe right side. They are not truly happens like on both sides. And similar on the body part. So like we see the picture here, they only happens on the right side or maybe left side. They are not passing through to other side. That's because of spinal nerves and the cranial nerves. They control one bunch, only control one side of the body. Certainly we have another bunch will control other side of the body. But we say these kind of virus, they hiding on the root part of the bunch there. So when they got infections, they will follow the same nerve bunch, go to the body. They are not passing through, go to other side. So that's clinically we can see patients in some part of body, just one side is painful, or maybe some skin rashes and blisters. So that's mainly clinical symptoms. This illness pretty commonly here, even in our acupuncture clinic. We are pretty common to see the patient coming with painful situation. So sometimes before the skin rash and the blister appear, patient will be painful. And also sometimes the blister disappeared, skin rash disappeared, they still possible painful. And the acupuncture treatment pretty effective to treat these kind of problems. So we say sometimes patient got like a painful situation first, then skin rash, damaged, and then after a few days, skin rash and blister disappeared, but still possible painful. And the painful situation can like keeping there for a pretty long time without treatment. So that's truly clinical symptoms. And the aging people is more easily got these problems. So when we talking about what's the best medicine diagnosis for this illness, so basically by the skin rushing there and then some painful situation in there, they are especially on one side of body, basically can get a diagnosis already. But truly we can go to some laboratory test like a virus cultures and some blood tests, we can get a pretty clear diagnosis. So that's for Western medicine. And for the treatment, so basically, because clinical symptoms mainly is painful, so treatment mainly we try to use some medications, control the painful situation, or relieve the painful situation. Maybe some special kind of patients, they originally have some immunity deficiency kind of situations. We can use some medication for antivirus, but truly antivirus kind of medication is not that powerful like with antibacterial. But we can use some medication to help each other, especially for some people have immunity deficiency kind of patients, or maybe aging patients. So that's basically by Western medicine kind of treatment part or diagnosis part. Then we moving with TCM part. So for the TCM, we still have illness name like Martin with the hypers or singles. So basically, by the skin issue, like the skin rash and the redness, like a snack in there. So that's we got the name, 蛇唇疮. And also maybe like some red band look like a source in there. So we got a different name based by their clinical symptoms. But truly, mainly we see the symptoms is on the skin and the redness in there, and especially on one side of the body. So for etiology, the illness, the reason cause the illness, we say that combination external passenger mainly is kind of heat toxin, evading, and the combination with internally some deficiency in there. We're talking about body 正气 deficiency. This kind of deficiency may be caused by emotions, 7 emotions, may be caused by eating not properly, and may be caused overworking, fatigue, or may be caused by people have long-term illness and cause body deficiency, and even by the aging. People getting old, their body heat or their kidney, including spleen and the lung, will have different degree kind of deficiency in there. So then cause this illness. But generally say that's a combination reasons, external reason and internal reason. External reason, passenger evading. Internal reason, body 正气 deficiency. Then cause this illness. I have a patient. Yeah, I have a patient. He's about 65 years old. Generally healthy. Yeah, generally healthy. One day he go to fishing. So certainly they stay close to cold water, even in the summertime. But still the environment is pretty cold there. And sitting there like about 6 to 8 hours, and he brings something to eat, but it's cold and a little bit harder to draw. He eat it. But the second day, one side of the face got pencil on the left side, and also on the superficial of the ear is pencil in there, and the diagnosis for shingles. So that's generally we're talking about during that environment, external pathogen easily invading. And aging people, their body density kind of difference, especially eating some little bit cold and hard, difficult digestion food. So that causes the problem. Some people can tell you what's how they cause. Some people maybe couldn't tell you. They say, I don't know. They just people. They just people. But truly, if you ask some detail, you may find something maybe caused by identity difference and find some special kind of situation, pathogen invasion. Then we go to different pattern and talking about the treatment for different pattern. So the first pattern we talk about the liver, gallbladder, T stagnation, and then cause some fear. Liver issue. Common issue of the liver, T stagnation. That's because liver's functions show and see. That's we talking about the moving T. So liver losing functions cause the mainly problem, T stagnation. When T stagnation, T not moving, everything not moving. Everything not moving will generate heat. Severe kind of heat, we say that's fear. So what's the difference, fear and heat? Severe kind of heat is fear, and fear easily rising up, cause problems. So that's usually we talking about liver fear rising up, maybe cause like a headache, dizziness, red eyes, red face. So when this pattern happens, we can see the red color, yeah, red color on the skin, especially in infected area. Yeah, we're talking about in the infected area, it's more red color there. And could be small dot in there, and could be meeting each other, form the patch. But truly is red color. And the heat in there cause patient burning sensation. Burning kind of heat in there and a severe kind of pain in there. So that's the local symptoms. And the patient will have some other pattern symptoms. Liver T stagnation, changing to heat and fear. Bitter taste in the mouth and dry dry mouth because heat damages body fluid. And the patient thirsty. They will like to drink cold water. And the heat inside make patients easily angry and irritability. And also like scanty yellow, dark urination, and dry stool, constipation. So that's the pattern symptoms. If we look in patient's tongue, will be red tongue body and yellow tongue coating. And if we feel the patient's pulse, will be very pulse and rapid. So rapid pulse is the heat. So treatment principle, certainly we need clear heat and dried fat and cooling blood, moving blood, and remove toxins. So liver excessive heat condition or liver failure condition, we have a typically formula we call 龙胆泻肝汤. We can modify the formula, but the original formula is 龙胆泻肝汤. 龙胆 meaning here, 龙 is dragon, yeah, 龙 is dragon. 胆 is gallbladder, but we have a herb's name we call 龙胆草. Long Dan Cao is a herb pretty good for clear heat and even remove some dampness from the liver. For liver heat and dampness condition. So that's the king herb in 龙胆泻肝汤. 泻 is purging, 肝 is liver. The meaning clear heat from the liver. So that's the special formula we use for liver failure condition, excessive kind of liver failure condition. Pretty commonly used. Yeah, pretty commonly used. We can see on the other illness, same pattern, use this one. These formula required by CTCMA. Yeah, looking for the ingredients. Yeah, ingredients inside and remember the ingredients. And certainly we can use acupuncture treatment. This kind of condition, at least locally, we are not use maxa. We say maxa we use for deficiency condition. This part is not mainly deficiency. And maxa used for cold condition. So this part is heat part. So we are not used for maxa, but we just use for treatment method. Together, we talk about 针 and 灸, that's for Chinese. But truly, this part we are not used for massage. But we can use acupuncture. And like I say, acupuncture pretty effective to treat these kind of problems. So, triple del 3, combination with gallbladder 41. So open the whole channel. Yeah, we know gallbladder channel go to side of body. This illness mainly from the side and then go to the center. So that's clear some heat toxins from the liver gallbladder also. And also we use 210, yeah, 210. Second is the points they can use cooling blood and relieve toxins, especially for the skin divisions disorder in there, especially when patients have like the chest area got singles there. We can think about this one here. Gluten is pretty good. And the liver too. Yeah, liver too. Clear heat from the liver. So for my experience, I like use jiaji points. Actual points, also called 华佗jiaji. 华佗 is a famous doctor's name. He found these points, then named it by his name, and sometimes it is simply called jiaji. So jiaji points about 0.5 away from the middle line on the both sides. Start from T1 to L5 below each of the vertebrae, 0.5 away from middle line. So totally we have 17 in each side and 34 on both sides. For Chiati points, we are not necessarily use all the 17 points, not necessarily use like 34 needles to treat. We just pick up the air, we treat the patient. So for these problem singles, let's see, like if they happens between T8 to T10, we just use that area of the jiaji points. If they upper, we just use upper part. Clinically, 华佗jiaji, like upper part we treat arm problems or upper jaw problems. Middle part we treat middle jaw problems. Lower part we treat lower jaw problems. The same idea. So where they happen, we just put the jiaji points in there. So that's in my clinic, like patient coming for singles and have painful situations, I will use jiaji points and pretty good relieve painful situations. So these kind of patients, we are not truly go to two local points, like the picture here. So if patient have singles, like this picture here, we are not able to put needles around this area because that causes very painful. Yeah, patient painful in there already. We are not put the needle there. But truly jiaji points, that's the nerve branch coming out from that area. So you can put jiaji points. So that's basically you can like open the whole channel, follow the nerve branch. So that's clinically you can choose also. So that's the first pattern. Then second pattern, we talking about spin qi deficiency with some damp heat. This pattern mainly is deficiency pattern. We say this illness is a combination excessive condition with internal condition and with excessive condition with deficiency condition. So some pattern may be more excessive, some pattern may be more deficiency. So truly, this pattern is more different, and then got passenger evils deleting. When we talking about patient have different kind of condition, usually it's chronic problem, long term. Patients generally weaker, like poor appetite, abdominal distension, losing stool, usually have a little bit longer time. And then got single infection, or we talked about external passenger infection. So basically, this kind of patient, the local is more yellow compared with we talking about last pattern. It's more red color, but this one is kind of more yellow, but it's more fluid in the like skin rashes here or blisters there, and pretty easily broken. They are still painful, but also like severe kind of more severe. So that's basically a combination. Patients have generally skin teeth deficiency syndrome. We say that's the pattern skin teeth deficiency with stomach heat. Tongue is a little bit swollen, yeah, but tongue is swollen here and a little bit larging. And maybe with some greasy, slimy, with some greasy, white or yellow tongue coating. It's depending how severe of the heat is. The pulse, sulky pulse, the same, softer pulse, yeah, safe pulse. That means, yeah, softer pulse. That's basically is dampness or fluid retention kind of pulse. Sleepy pulse, still dampness retention pulse. And rapid, yeah, rapid is heat. So that's combinations damp heat pattern. So for this pattern, truly we need to tonify the spleen. We say our treatment principle will matching for all patterns. Our pattern is spleen T deficiency. So we need to tonify spleen T. And also our pattern we talking about damp heat retention. So our treatment principle will clear heat and remove damage. So when we're talking about the treatment principle, we need matching our treatment principle with our patterns. And we also can add in there like a relief symptoms, like a stop pain. So that's the mainly patient looking for the treatment. Keep compliant. So this pattern we use formula 4妙3 加味 adding another ingredient there. We talking about 2妙3 before. 2 is 2. 2 ingredients inside 黄柏 and 苍竹. Then we also have 3妙3 3 ingredients inside. That's the formula name. Only 2 or 3 ingredients. So that's 二妙散 plus 牛膝。Now we're talking about 4 妙散 4 ingredients. Milk is wonderful. Milk is wonderful. Wonderful formula. Yeah. 2 ingredients in there form a wonderful formula. That's 2妙散. 3 ingredients in there form a wonderful formula. Is 3妙散. And 4 ingredients in there form a wonderful formula. Is 4妙散. 4妙散, now you know. That's 3妙散 plus 薏仁. So that's pretty commonly used formula we use for different kind of damp heat conditions. We can use 2妙散, 3妙散, or even 4妙散. So that's originally formed in there. Certainly we need to modify from there because these formula basically working for damp heat conditions. They didn't have herbs, especially tonified spring. So we need adding some spring tonified herbs inside. Or maybe we can add in like 四物汤 heat tonified herbs. Or maybe some other herbs inside, especially for spring heat tonified. And we can use acupuncture treatment. So we say we need tonified spring tea. So that's spring tea tonified and spring tea tonified. And also we remove some dampness. And clear heat. LFO is pretty good points, 3-6 pen, and also moving tea. So that's basically we use. So about masa part, we say masa good for deficiency, but not good for heat condition. You can pick up some points for masa, like stomach 36, but truly don't put too much heat inside the body. So that's for this pattern. Then we're talking about qi stagnation and blood stasis pattern. So this pattern, generally speaking, we say patient maybe have qi stagnation condition for long term, and then cause some blood stasis, then plus gout passage evading. So basically this pattern, if you're looking locally skin rashes is more dark and purple color. We know the dark purple color basically belong to blood stasis kind of color in there. And even like inside booster fluid, you can see some blood kind of color water inside. So still severe kind of pain. even more severe compared with other patterns. We're talking about blood stasis caused fixed sharpen. That's usually we're talking about blood stasis condition. So most severe kind of pain, most severe kind of pain. And if we're looking patient's tongue, pupil color, sometimes it's not whole tongue pupil, just some dark pupil spots in there on the superficial of the tongue. So like kind of pupil color in there. And the pulse could be very pulse, could be choppy pulse. Yeah. Choppy pulse is more blood stasis kind of pulse. Very pulse, that's the same meaning is very. Very pulse is more T stagnation kind of pulse, and also painful can cause very pulse. We say these kind of conditions, patient very painful. So these kind of patient or treatment painful, we need moving blood and relieve toxins and moving T stop pain. So painful situation always caused by stagnation. Maybe T stagnation, maybe blood stagnation. So moving T, moving stop, moving blood, stop pain. We have a special formula. 蛇床方 蛇 is snake. We say it look like a snake. The skin damaged there. 疮 is kind of sores or damage in there. Found this formula. This formula not in our CCN list. That's the special formula we treat for the single. If you are interested, you can look for the book. So that's basically you can go from there. And the acupuncture treatment. Acupuncture treatment, we're talking about moving T, moving blood. So that's we still can go to LF4, moving T, and 3焦6 clear some heat, and the Parcadin 5. PC5, yeah, PC5. So that can open the channels, clear some heat, and also moving some blood. And the spleen 6, that's 3. For myself, I like to use some spleen 10 instead of spleen 6 for these conditions. That's more moving blood. And also bladder 17. Still blood moving. Still blood moving. We say this condition, especially is like T stagnation and blood stasis cause. So we need more points to move blood. So some local treatment, not too local. Too local will cause patient painful. Like you still can go to 甲己 points. Or maybe you can do some needles around the local area. Not directly go to skin injury or skin rashes with the area. But you can do some needles around it. Because if you go to directly go to that area, cause more severe kind of painful situation. This pattern I still not suggest you use So that's basically for this pattern. Then we're talking something, beside we talking about before. So generally say we say these illness, singles or hybrids, for most people, they will combination patterns. We say they may have some underlying body condition, gene difference, and with damp heat condition. Swing performing T and T functions. So T and T not working, and like everything not circulate. So water retention cause dampness, and the dampness pretty easily combination with the heat. So that's from some damp heat. And also may combination with liver T stagnation kind of condition. And also severe case, maybe with blood stasis kind of conditions, especially if they happen in people getting aging, old people, or maybe patients with severe kind of disorder for a long term. So these kind of patients is always have like a Qi blood difference or maybe yin and yang difference. So that's basically we say this illness is pretty easily happens in the aging people. And the aging people pretty easily have originally underlying body condition, deficiency kind of condition. Yin deficiency, yang deficiency, qi deficiency, and blood deficiency. So that means in our treatment plans, we need thinking about body's underlying conditions, maybe some difference in there. We need to do some tonify. At the same time, we relieve the pathogen. So that's we need to think about this illness, combination pattern, excessive and deficiency, and most people with deficiency kind of condition. The second aspect we need to think about affected area. So for TCM, if the illness happens in the upper part of body, that's mainly relationship with the heart and the liver. So heart belongs to upper jaw. So upper part of body, more relationship with upper jaw. And the liver performing 疏泄 functions. Liver disorder can affect the upper jaw, middle jaw, and the lower jaw. So that's upper jaw problems may still possible caused by liver issue. And if sick part the air in the middle part of body, that may be relationship with spleen and the liver. Like we talked about, the spleen belong to middle jaw, and the liver can affect three jaws, upper, middle, lower. If the sick air in the lower part of the body, that's mainly relationship with the kidney and the liver. So kidney belong to lower jaw, and the liver also circulation all over the body. So we can thinking about the patient's conditions, like we talked about before. That's the pattern excessive with difference. So that maybe some excessive or different part, including different part of body. We can thinking about different organs. Maybe we need to tonify. Maybe we need to reduce it, depending different kind of situations. So then we need to be careful. Yeah, then we need to be careful. If patients got this kind of illness, some food may cause more symptoms more severe. So like some spicy food during patient have this kind of situation. No spicy food, no hot food, no greasy food, no fatty food, no think flavor kind of food, and not drinking alcohol. So all of these can make the symptoms worse. I think including coffee. Yeah. Coffee is cold, it's hard like coffee. So this illness mainly is the damp heat condition. So we need to be careful some of the food we eat. So if we eating this kind of food, maybe make the symptoms worse. So during the illness attacking time, truly we need to be careful the food we eat. And truly more vegetables, more vitamins, so that easy digested food will good for the patient. And if spleen spatially difference, try not eating too much sugar or spicy food because we know sweating kind of flavor go to the skin, especially patients with the spleen deficiency kind of condition. If we eating too much sugar or sweeting kind of food, it's more damage spleen function. So that's even some food they contain more sugar or sweet flavors in there. We still need to be careful not eating too much. So that's basically for food aspect, we need to be careful. So these illness, we say the mainly problems is skin rash, blisters, and painful situation. So generally speaking, the skin rash and blisters, they can healing by itself. So whatever with treatment or without treatment, so patient got a painful situation, then skin rashings and blisters there. Then they will like a healing by itself. So generally it's not that severe kind of problem. But the painful situation is the more mainly problem cause the patient feel sick or affect the patient's daily life. It's always sharp in there. So truly, use herbs, Chinese medicine, and especially acupuncture pretty good help people to relieve pain and certainly can help patients like relieve low colds like skin rashes, and help patient recover faster. So that's generally this kind of patient, especially with painful situation, looking for treatment. We can combination with the Chinese herbs with acupuncture together. Even only acupuncture treatment still pretty effective. So that's about this illness. Yeah, Singles, yeah, singles. So this patient, I believe, you will be see later in your acupuncture clinical practice, and it's pretty common case, the illness.